Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about science. In 1841, Charles Mackay wrote, "Men, it has been well said, think in herds. It will be seen that they go mad in herds, while they only recover their senses slowly and one by one." We're now into week 26 of the 2-week lockdown to flatten the curve. One of the few countries which didn't buy into the COVID insanity was Sweden. Sweden has, for all intents and purposes, defeated COVID-19 without lockdowns, without mask mandates, and without violating human rights. Sweden only has 13 COVID patients in intensive care and is only averaging 1 death per day over the last 10 days. COVID alarmists have been screaming that Sweden's herd immunity strategy was reckless, yet here we are, they've achieved herd immunity. I'm going to show you in a few minutes that there's nothing new or reckless about what Sweden did, and in fact this has been understood for at least 180 years. This graph shows daily COVID-19 deaths in Sweden going back to the middle of March. Sweden had a large spike in deaths back in March and April when they, like many other countries, failed to adequately protect their nursing homes. But since the middle of April, deaths have been steadily declining in Sweden, and for the past 2 months there's been very few. Sweden ignored the absurd alarmist predictions being made by COVID modelers. This graph shows actual Swedish daily deaths in black, and the red dashed line shows what the COVID modelers predicted. Dr. Anders Tegnell, who architected the Swedish policy, was smart enough to understand that the COVID modelers had no idea what they were talking about. Countless lives around the world have been ruined by incompetent COVID modelers, but not in Sweden. The worst modelers were in the UK. Let's look and see how they're doing. The turquoise line shows UK cases, and the red line shows UK deaths. Note that the y-axes are not at the same scale in this graph. The death count is greatly magnified in order to make it more visible. The UK death count, shown in red, has a very similar shape to the one in Sweden. They achieved herd immunity a long time ago. But unlike Sweden, UK policy is driven by superstition rather than by science. Long after the UK achieved herd immunity, the UK government mandated masks. And since then, the UK has seen a rise in cases, but there's no corresponding rise in deaths. So what are these cases? Whatever these cases are, it's not a deadly virus because it's not killing anyone. Whatever this second wave in cases is, it doesn't appear to be something which people should be worried about. And we see exactly the same thing in France. They have a huge second wave in cases, but no increase in deaths. And exactly the same story in Italy, an imaginary second wave. And the same story in the Netherlands, a gigantic increase in cases, but no increase in deaths, an imaginary second wave. And once again, the same story in Belgium, another country which achieved herd immunity a long time ago, but has seen a rise in cases recently. Sweden saw a rise in cases 3 months ago, but since then cases and deaths have both been declining, because Sweden's policy was driven by science, not fear, panic, and superstition like much of the rest of Europe. The concept of herd immunity, which Sweden and most of the rest of Europe have already achieved, has been understood since at least the year 1840. William Farr did a very detailed study of deaths in England and Wales during 1838 and 1839, and he published them in 1840. He discussed how the disease was transmitted through the population, and he asked, why do the 5 deaths become 10, 15, 20, 31, 58, 88 weekly, and then progressively fall through the same measured steps? And the reason that the deaths fell was because they had achieved herd immunity. After a few weeks, the virus started having a harder time finding vulnerable people to infect, so the death count went down. That's what herd immunity is. So what Sweden did was nothing radical. They just did what's been known for 180 years. It was the rest of the world which locked down, which went insane. Also note that the smallpox epidemic which he was studying had a much higher death rate than what we've seen from COVID-19. For children under the age of 5, there were 54 deaths out of 1,000 population, as compared to pretty close to 0 for COVID-19. In fact, for people under the age of 45, COVID-19 hardly kills anyone, whereas smallpox killed huge numbers of younger people. Now let's go over to the United States and look at the insanity which is going on over here. The Washington Post reports that 6 Miami University students who had tested positive for COVID-19 are being fined $500 each for having a party. Of course, these kids don't look sick, and the Washington Post isn't saying anything about them being sick because they're not sick. In fact, among the 26,000 college students who've tested positive for COVID-19, not a single one of them is in the hospital. This problem has been understood since at least April, when it was reported that in 4 U.S. state prisons, 96% of the people who tested positive had no symptoms. When the first cases of the new coronavirus surfaced in Ohio's prisons, the director in charge felt like she was fighting a ghost, because there were no symptoms. These people weren't actually sick. Even the New York Times has recognized the fact that COVID-19 tests are for the most part worthless. They're much too sensitive and they're not actually detecting sick people. A few months ago, even Dr. Fauci recognized that asymptomatic people cannot drive an epidemic.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
The whole basis of lockdowns, mask mandates, and school closures is based on the theory of asymptomatic transmission, which obviously Dr. Fauci himself doesn't even believe. The madness which is going on now is completely unjustified. Only 0.01% of the world's population has been killed by coronavirus, and the vast majority of them were very old, sick people who are likely to die in the next year or two anyway. This pie chart has a little tiny sliver for coronavirus deaths around the world, but it's almost too small to even be visible. COVID alarmists keep bashing Sweden because their death rate was higher than it was in Norway and Denmark. But the reality is that the death rate in Sweden is lower than it is in most of the countries where people are bashing them. Countries and states which locked down are shown in red, and countries which didn't lock down, Brazil and Sweden, are shown in blue. New York City has by far the highest death rate in the world because Governor Cuomo sent thousands of sick people into nursing homes and killed off lots of grandmas and grandpas. Cuomo then shipped the dying grandmas and grandpas off to hospitals so that they wouldn't be counted as nursing home deaths. So let's look at all the places which have higher death rates than Sweden. New York City, New Jersey, New York, Massachusetts, Connecticut, San Marino, Louisiana, Rhode Island, Peru, Mississippi, the District of Columbia, Belgium, Arizona, Andorra, Michigan, Illinois, Spain, Maryland, Delaware, Pennsylvania, the UK, Chile, Bolivia, Ecuador, Brazil, Italy, and the entire United States of America. There is zero evidence that lockdowns and mask mandates are of any value. Sweden defeated the virus without lockdowns, without mask mandates, and without vaccines. All that they needed was science. And because Sweden used a science-based strategy and clearly explained it to their population, the people of Sweden are not afraid. It's unfortunate that people in other countries can't be the same way. The world went mad in a herd. Hopefully the example of Sweden will help other countries recover their senses. Toto doesn't like being around crazy people, and there's a lot of them these days. Hopefully they will regain their senses soon. You can visit Toto on the web at realclimatescience.com.